Absolutely not. Absolutely not.
Next is a comment that I had under one of the older Tadalafil videos we did a few years ago, but people are still watching it and writing comments. And some comment wrote this. These guys need to be honest and admit that they recommend Tadalafil to open up your veins and arteries to move all that thickened blood from TRT. Is that true, Gil?
Absolutely not. Absolutely not. Less than 30% of my patients are on Tadalafil. In fact, we don't really run into erythrocytosis because we manage the protocols and the frequencies correctly. And when we do run into mild erythrocytosis, it's generally a non-issue, unless you have severe comorbidities that put you at higher risks of PEs, DVTs, etc., which again, the coagulation cascade, especially intrinsic coagulation, really has nothing to do with erythrocytes. This is a platelet aggregation issue coupled with arteriosclerosis or hardening of the endothelial lining, coupled with possible calcification and plaque buildup from triglycerides and poor unmanaged years of cholesterol. And that is when erythrocytosis starts to possibly be an issue. When you already have all the other perfect storm problems, and now you're adding in a mild viscosity increase to the blood flow, that is when we start to look at it. But I'll be honest, we generally don't start men on TRT who are hypertensive and obese and have severe issues that they need to address with their primary care physician first. So we don't give men Tadalafil to mask a potential problem that is not a problem.
But you do recommend Tadalafil for your patients?
We explain the mechanism of how it works, the benefits that it can have, and if they think that they are a candidate for it, by all means. We don't have a blanket procedure. We don't have protocols that say every man must or should use a particular medication. I'm a fan of less is more. The less medication you can use to optimize your lifestyle, the better. Medications are not there to just, put an age on and say now everyone should be on ABC. If you need it and you benefit from it and it doesn't harm you in any way, then sure. But like I said, I have about 70% of my TRT patients are not on Tadalafil. And there's nothing wrong with that. I'd love nothing more than have no patients on any medications. We don't sell medications. We're not a pharmacy. So it doesn't matter to me what medications you use or don't. I prefer you use less medications. We don't get paid for giving you more drugs. We simply get paid for oversight, management, and information. And that information may change, but if it changes to reduce the amount of medication you're on, so be it. That's a win.